There's a lot of misinformation about fillers on social media, and I think that's unfortunate. Fillers don't lift. They fill. They will volumize. When they do that, there is some change in the regional area, but it's not something that lifts. There's fillers that, when done correctly, they have a really good result. But then if you, every 6 months, get a syringe of filler on a regular schedule, that's not great, and it can lead to a bizarre appearance. When it's your face and you're looking in the mirror, you see certain things more so than others, and you just kind of hyper-focus on certain things. You see the trees and not the forest. It's hard to see your own face in proportion, in perspective, and see the whole impression. Your eye naturally gravitates towards certain things that bother you for a variety of different reasons. It's our role as aesthetic providers to guide our patients into an understanding of what the overall impression is and where it would be beneficial overall to give our attention. Papers in the New England Journal of Medicine talking about how silk pillows help with new lines.
Big silk and big tape aren't going to be funny.
But that's okay. These are not things that are like super risky interventions that you have to be careful about.
Welcome.
Thank you. It's a pleasure to be here.
I'm going to put you on blast right now in front of my whole audience. When we met in the lobby, I was like, nice to see you again. Dr. Ripken didn't remember that he treated me a few years ago, which I am totally fine with. I understand. It's a good thing. You have so many patients. You're so good at what you do. So I don't expect you to remember somebody from many years ago.
Thank you. Thank you. It's still embarrassing.
No. I wasn't trying to embarrass you. And I also said to you, hopefully it's because I look so much better than I did 3 years ago.
There you go. I'll tell you a little story. So I'm so bad at that kind of thing that at one point, and this was years ago, I went after work. I went to like an art opening, and a woman came up to me and she was like, hey. And I was like, oh, hello. I wasn't sure who it was and anything like that. She's like, oh, you don't remember me. She's like, oh my God, you don't remember me. First of all, she goes, I am Brazilian. And so you have to remember, because it's just like, people remember me. I can't believe you're. She's like, and second of all, I was just in your office today. I'm like, oh my God, it's so embarrassing.
Same day?
Same day. It's terrible. So,
well, I would imagine when you're looking at somebody, when you're working, maybe you're looking at them in a very analytical way.
Right.
Whereas when you meet somebody out,
different
you're not.
Context. Yeah.
Yes. Yeah.
So,
yeah.
Anyway.
You can use that in the future, by the way.
Thank you.
So I would love to start with, what is your beauty philosophy?
My beauty philosophy is that there's guidelines that we know about from scientific studies about what the eye likes to see. And those are relative guidelines. And it's just kind of, there's things that are programmed within us in terms of aesthetic response through our brains. Like our eye likes to see certain things in certain proportions. And that goes across cultures, and that goes across facial types and across ethnicities. But that's not the whole story. The other very, very important part of it is that everybody's an individual and everybody's very much particular. And my friend Ava Shambam, she formulated this concept nicely in an idea called, I think she called it signature feature, right? So everybody has their signature feature or signature features that are the kind of defining aesthetic elements of their face. And so enhancing that and just kind of working to really bring forth the person's unique beauty, that's my philosophy.
I love that answer, but I want to rewind a little bit and talk about what are those things that we are programmed to like seeing when we see somebody's face. I mean, I know that when you look at somebody, you look at their eyes, right? So I would imagine that that's part of it. But what are those like nuanced, proportional things?
Okay, so that's a really important part of it. We're animals, right? And so we're programmed to some degree for reproduction. And so we are evolutionarily programmed to select mates. And so when we look at someone, we evaluate subconsciously, just automatically, how healthy they are, how kind of feminine or masculine they are, and how youthful they are. And so how they are in terms of reproduction. A lot of times for beauty is related to, kind of feminine reproductive potential, masculine reproductive potential. And there's a variety of signs that kind of clue our brains into what that reproductive potential is. And there's signs of youth that the eye looks for. And one of those signs is, as you were talking about, your eyes, right? And so a face where the eyes are the central focus of the face is a face that's youthful. A face that is kind of oval in shape is a face that's youthful. For a more feminine face. For a more masculine face, it's a different kind of shape. It's more of a square shape. And as we age, the face changes. And for a feminine face, it becomes less feminine. And so that oval shape becomes more kind of rectangular, a little bit more masculine. And that emphasis around the eyes becomes less. The eyes become less of a focal point. And when you look at someone's face that is older, your eye wanders around the face a little bit more. Whereas when you look at someone's face who's younger, your eye goes straight to their eyes. There's a reason for that. When you put something up on the wall, if you just put it up on the wall and you don't frame it, it attracts a certain amount of attention. If you put something up on the wall and frame it, it attracts more attention. And so it's the same thing with the eyes. So when the eyes are framed by the cheeks and and there's no distractions in other areas of the face, so shadows, lines, all that kind of stuff, then the eye of the observer goes to that person's eyes, and they're perceived as being more youthful, healthy, and fertile. Aside from that, there's also proportions that the eye likes to see. So we divide the face, classically we divide it into thirds, where it's top third, middle third, lower third. When they're about the same, that's something that's visually pleasing to the eye. When we divide it into fifths this way, and when those kind of fifths are about proportional and the same, the eye likes to see that.
It's interesting because I feel like a lot of times when people go in to get aesthetic treatments, I'll speak for myself, I hyperfixate on one thing and it's not necessarily the thing that's the problem, right? So can you speak to that? Because I'm sure you see that all the time in your practice where somebody comes in and they're like, oh, my lips are too small, or I need filler in my cheeks, but they have deficiency in their temples or whatever. So what are the most common kind of mistakes that you see when people come in thinking that they want one thing when really they need something else?
I think that's very common. And I think that when it's your face, and I do the same thing. Everybody does that. When it's your face and you're looking in the mirror, you see certain things more so than others, and you just kind of hyper focus on certain things. You see the trees and not the forest. And it's hard. It's hard to see your own face in proportion, in perspective, and see the whole kind of impression. Your eye naturally gravitates towards certain things that bother you for a variety of different reasons. And it's our role as aesthetic providers to guide our patients into an understanding of what the overall impression is and where it would be beneficial overall to give our attention or to focus on. Now, that doesn't mean, usually when somebody says, I'm really bothered by this, doesn't mean that I say to them, oh, I'm not going to do that. I'm going to do something else. You still address, what they're there for, but then I kind of try to guide them a little bit about saying, well, you could think about this, you could think about this in order to get, what's, and it's a conversation about well, tell me about how you feel when you look in the mirror. Tell me how you feel. And you just kind of a conversation about how things are going and stuff like that. And if they're talking about how, well, considering filler in my lips, when they're saying that they are bothered that they're looking older than they feel, I can give them suggestions on some of the things that they can do to overall have an impression of a younger face. Because a lot of times, it's volume loss is associated with, looking older, and shadows, around the eyes, or shadows in nasolabial folds and stuff like that. So correcting some of that stuff can really be, can really have a big impact on the overall impression of the face. And so I'm fortunate in that within my practice, now people come in and a lot of times say, what should I do? And then I can really guide them in terms of what I think would be the best and the most beneficial. And also, it's all this stuff costs money, and so what would be the best bang for their buck? And I think that's really important.
Yeah, it's like harmony, right? Facial harmony versus just fixating on that one thing. My best friend and I always joke we wish that we had each other's eyes, because I see her every week and I'm like, my crow's feet are driving me crazy. I haven't gotten Botox in 21 months now. And that to me is like my hyperfixation. And she's like, yeah, I don't know. It's not like really registering for me as like a problem. And she has this thing in her lower face. She calls them pooches. And she's like, they're driving me crazy. I need to. And I'm like, I don't even see them. Like, we're like, we wish that we could trade eyes. And I'm sure that if I came into you or another provider and said, what should I do? Like, there would be some other things besides just like a little Botox and the crow's feet.
Or maybe not.
Oh,
maybe that's it. Maybe that's all there is. From here, that's the only thing I see.
Oh God.
So,
I know.
But
well,
I mean, we're all so critical of ourselves, right?
Yeah.
Isn't that silly? It's just, it's too bad.
What are some good Botox alternatives? Because this is something that I get from so many people in my audience, whether they just don't want to keep doing Botox all the time, they can't afford it, they might be pregnant, they might be breastfeeding, they might just be taking a break, they don't want to do it yet. I mean, there are so many different reasons. And there are a lot of things that are touted as Botox alternatives. Some of them are, you know, more efficacious than others, although there isn't really a true alternative. But from your experience, what is like the best thing that you can do to kind of hold off on that?
I don't think there's a single best thing, I'll tell you honestly. Whenever there's a desire in the marketplace, there pops up a whole lot of people who are very much willing to meet that desire. And whether that product that they're offering actually meets the desire or not, they don't really care sometimes. And so sometimes you have these products that tout, oh, this is the, you know, the alternative to Botox, and it's really not. I think that botulinum toxin in general is an incredible tool. I mean, we have 3,000 studies on botulinum toxin, whether it's therapeutic or cosmetic. So the safety and utility of the drug is really established very, very well. Other things that help with skin quality, so retinol, for example, is really nice. And I think it turns skin over really quite well. It helps with skin quality, with skin collagen content, with fine lines. So I think that's something that is very, very useful. And, you know, when used regularly, I think it has a very good effect. There's procedures that we do, like microneedling, like some of the microneedling with radio frequency. And those kinds of things do the same kind of thing. They make the skin, you know, they increase the collagen content of the skin. They improve fine lines, they improve the texture of the skin, and I think that's really nice. And then, you know, good products, you know, like having a good sunscreen that you use on a regular basis, whether it's indoors or outdoors, you should have something on that works to protect your skin. And then, you know, there's a bunch of other stuff. There's antioxidants and these kinds of products that I think the evidence for that is a little bit thinner, but you know, I think that those could be also somewhat useful. I think anything that says this is an alternative to, this is like the topical alternative to Botox, or buy this and you won't have to do Botox, I think that's pretty reliably not true.
Yeah, so let's debate face tape, okay?
Oh my God. You know, okay, so I put up a post about that, but I actually don't think there's anything wrong with doing it at night, except, you know, if whoever is next to you in the bed thinks it's kind of weird thing.
Yeah. So, you know, I get a lot of pushback about this from doctors. You probably know my whole story. I had a horrible, horrible reaction to Botox, debilitating for months, couldn't function, tried a few units again once I got better, had a horrible reaction again. So it's off the table now. So I'm in a position that I never wanted to be in. And I've been looking for alternatives. So I came across face tape in desperation, not silicone tape. I want to make that clear. I tried that. That was horrible. But I always try to make it clear that I'm not comparing it as an equivalent to Botox. And it's not a panacea either. But for me, who I wake up like this, I am, I guess, expressive in my sleep. I never knew, because for 10 years I was completely frozen. And now, like, I'll wake up with horizontal lines, and I sleep on my side. So I get like lines on my side. So a few nights a week, I'll do the tape and I wake up completely smooth. Is it going into my muscle and inhibiting movement 24/7? No. But if I have a podcast, or if I have a shoot or something that I just want to wake up smooth and try to kind of maintain that. It's been great for that, but there is only one that I like. I don't make any money from it, but adhesive wise, I've tried different ones and some of the adhesives are so harsh, so harsh. So there's one that's like extremely gentle. It works over my skincare. I can do everything, non-irritating. And for me, it's been a good, not alternative, but
it helps.
Option to help. Yes. Yeah.
No, because one of the main things about Botox or, whatever, any of the kinds of botulinum toxin that we have is the preventative function, right? And the preventative function is just that it keeps you from, the less you do this kind of thing, the less, these lines etch into the skin. Where at first, when you're younger, you're smooth when you're relaxed and you just make lines like this. But then as you get older, and as you do this expression more and more, those lines etch into the skin. So even when you're relaxed, they're present. So we're trying to prevent that. I think this is reasonable. I think this is totally reasonable, because at night we have dreams. We make facial expressions. We're like terrified about whatever it is that we're dreaming about.
Yeah. Somebody said that if you tend to run anxious, you're more of a raiser. And if you tend to run a little like angry or something, or I don't know, you scowl. I don't really do that, but I guess that I raise my eyebrows. And I usually put it on after my boyfriend goes to bed, but he doesn't care anyway. It's like so benign. It's 3 little strips, but there's other things like silk pillowcases and things that like help to just not cause so much irritation and like smushing of my skin. I try to sleep on my back. I just can't. I would rather get 8 hours and be comfortable on my side than...
I know. So my training is in ear, nose, and throat. So I used to be a head and neck surgeon. And so one of the things that we used to do is to tell people, because one of the things we used to do is for people that would come in with like heartburn or with postnasal drip, we'd tell them to, you have to sleep on your side. You can't sleep on your back. And they were like, well, it's hard to do that. So we tell them to take a tennis ball and sew it into their pajamas. So they'd have a tennis ball on their back. And so they wouldn't be able to rotate because it would be super uncomfortable. So, you don't want to do that. You're just going to...
That sounds horrible.
It's not.
No, I know that
great.
They have those pillows that you can lay there. And the only time I've ever slept on my back was when I got my boobs done. Then when I got my boobs out and when I had my nose done, I think whenever I absolutely had
it's
to.
Hard.
Yeah.
Totally.
Yeah.
So those things are helpful. Is there like, papers in the New England Journal of Medicine talking about how silk pillows help with new lines?
Big
There's
silk
not.
And big tape aren't going to be funding.
But that's okay. These are not things that are like super risky interventions that you have to be careful about. But so I think it makes sense.
I mean, there's so many trends.
Yeah.
That I would understand being in your position, seeing a lot of this stuff and just being like, come on. I think that it also kind of depends on like who's posting it, what do they have to gain from it? I mean, there's a lot of...
For sure. I mean, I just saw a patient who came in actually last week and she had like sores on the, in a crow's feet area. And I'm like, what's going on? And on both sides. And, she was like, yeah, it's because of this tape that I'm using. And every time I take it off, it really like disturbs my skin. I'm like, yeah, you can't, that's the wrong kind of tape, clearly. So it's good that you found something that really works well.
Are there any other trends that you have seen going around that just drive you nuts? I mean, I know like some of the trendier things right now are things like salmon sperm. And I know that people like it topically. It's not FDA cleared, right? Or approved here for injections, but it's been in Korea for like forever.
It seems to work quite well. So it's polynucleotides and yeah, I mean, it's not actual salmon sperm.
Yeah. It's just like the sexy name.
Yeah. People like the name, but it's, it does seem to be pretty effective, more effective when it's injected, but still pretty good. We use it for, when we're using it with procedures like microneedling and also with lasers, both to make the effect better with collagen stimulation and to kind of help with the quality of the skin afterwards, but also to decrease downtime. So it works quite well from that standpoint as well. So I think that it's good, and I think that these procedures make sense. Again, is there studies in New England Journal of Medicine documenting this? The evidence is a little bit thin, but it seems to be, the reports from Korea are quite good. And so I think it makes sense. Other stuff like this whole thing about, there's a lot of misinformation about fillers on social media. And I think that's unfortunate because sometimes that comes from the kind of surgical side of our industry. And I want to qualify that by saying that the problem with social media is that the more extreme the opinion, the more traction it gets. And so sometimes people will say and answer, like, will talk about things in a fairly nuanced way and say, well, okay, there's fillers that when done correctly, they have really good results. But then if you every 6 months, get a syringe of filler on a regular schedule, like some that happens with some of these med spas, that's not great. And it can lead to a bizarre appearance. And I think that's a rational statement. Sometimes those kinds of nuanced statements, they get edited down to be more extreme. And so you have people seeing statements that are less than accurate, not from the fault of the surgeons necessarily, but just because that's the way it gets kind of edited down with how it's presented. Because these fillers are great tools, but you have to use them correctly. And so when you use them, when you use correctly, when you use conservatively, it really works very, very well. And so there shouldn't be a fear of them. There should just be a concern about making sure that you go to someone who's experienced, who's skilled, who's knowledgeable, and who has a good aesthetic eye. And those are the key things. It's not the filler. It's the hand behind the filler.
I would love to talk a little about fillers versus biostimulators because, Sculptra is so trendy right now as well. And everyone's like, oh, it's natural. So what is the difference and what are the best applications for both?
So we have these great tools. So in terms of fillers, mostly it's hyaluronic acid fillers. In terms of biostimulators, it's either Sculptra at this point or dilute radius, which is calcium hydroxyapatite. I see the hyaluronic acid fillers as more precise and more specific in terms of what you want to do. And sometimes that's important. For me, I do a lot of facial sculpting. So I want to emphasize, certain things or smooth certain areas or get more definition. For example, in the jawline, in the chin, in the nose. I want very specific effects. And that kind of thing can only be done with a filler. Because just getting an edge or getting a kind of a specific contour. When we're talking about a more general volumization, then I think biostimulatory kinds of products I think are quite good. So when you have volume loss in the cheek, volume loss in the temple, and you want to kind of have more of add volume to a larger area more broadly and softly, and that's the kind of the aesthetic effect you want to achieve, those biostimulators work really quite well. Assuming people are okay with coming back a few times, because it's not one time. It's really, you got to do it for most of them 3 sessions, sometimes 2, but mostly 3 sessions. And they stimulate your own collagen to growing. It's a little bit variable depending on the person. So sometimes, you get more of an effect. Sometimes you get less of an effect depending on just sort of the physiology of the person. I think they make sense. And there's a lot of attention now in our industry in expanding that portfolio of tools and in exploring of how they work best, how to make them work even better. And I think that's great because and there's more. Yeah. So there's and so when we get more of those tools, I think that'll be exciting. But I think it's you have to have the guidance of your injector to know which one is more appropriate for which kind of indications, because it's not just it's not one thing for everything.
You mentioned noses. You pioneered the non-surgical nose job. So let's talk a little bit about that, because I think in all the years I've been doing this and all of the providers I've had on, I don't think we've ever really discussed that specifically. Who is it good for? What can you accomplish? Who is it not good for?
Non-surgical nose job or non-surgical rhinoplasty is by far my favorite procedure that I do. It's very rewarding. People just are so happy with their results because it's something where I can be very, very precise about the effect I want to achieve, and it saves people an operation. So for so long, people have understood that the only way to change the contour of the nose is through surgery. Now, this procedure is here where in 5 minutes, you can really significantly change the contour of the nose, and in a way that's so precise and so specific that in some cases, with everybody, but with a lot of people, it's more precise and better than surgery. And so again, every tool and every kind of procedure that's a good procedure has its uses. And so for some people, surgery is certainly the way to go. And I have a series of people who I would refer to who I know do a really good job with rhinoplasty. And then they refer non-surgical patients to me because, maybe they've already had surgery and they just want correction of a small thing, and it has to be very, very precise. And it's something that is very difficult to do surgically. And it's something that's very easy to do non-surgically. And so they'll refer to me, and we do that. I think, so for patients who need reduction in their nose, that's not a patient for non-surgical rhinoplasty. Now, there's a caveat to that. For people who have a bump or people who have a tip that's coming down, they look at their nose and they think they have a big nose. Sometimes they don't actually have a big nose. It's just that when you have a bump or you have a tip that's coming down, it looks like your nose looks bigger because it stands out from the rest of your face, right? So it attracts more attention from the eye because it's irregular. It's not the contour that the eye expects. And so therefore it looks bigger. So the funny thing is, in those kinds of patients, I add to their nose, right? And I make it look smaller. Because it's straighter, because it's more of what the eye expects to see, it blends into the rest of the face and it looks smaller. This is the kind of thing that gets me really excited about the things that we do, right? It is that we, in doing these non-surgical procedures, in doing facial sculpting, we are directing the gaze of the observer to the areas that we want the observer to see and away from the areas that we don't want the observer to see, right? And so we are guiding the gaze. And so it's a little bit of illusions. We work with illusion, we work with perception. It's not necessarily obvious, the effect that we're trying to achieve. And this is a great example of when you add to someone's nose, but you're making it look smaller because it's straighter and it blends into the rest of the face. I think that's kind of cool.
And then you probably see their eyes first.
And then you see their eyes first. No, but that's absolutely right. Because the nose, you have a bump in the nose, or you have a nose that's kind of maybe off center. And then when you look at their face, you see their nose. You make it straighter. You make it, straight on the profile, straight on the front. Now you're looking at their eyes. And that is always the most beautiful part of someone's face. When somebody hasn't had surgery, a lot of times it's somebody with a bump or somebody with a tip that's coming down that wants to make a nose straighter on the profile. But then the other bigger actually component of people that come in to see me at this point are people who have already had surgery. And then they've had a rhinoplasty. The result was maybe a good result, but then over the years, scarring happens. And the nose is it's a feature of the face that over time after rhinoplasty can change contour in a way that doesn't look quite as natural anymore as it did before. And so they come in to see me and they want to maybe correct small contour irregularities, small kind of, asymmetries, that kind of thing. Again, it's something that's very, very precise, and it saves them an operation, especially a revision operation for rhinoplasty is complicated. It's expensive. It's, there's more risk involved. There's downtime. And so if you can do that in 5 minutes, it's great.
Yeah. So you mentioned risk. There are risks with the non-surgical rhinoplasty, right? So we don't want the listeners to just run and go to any med spa or Groupon and be getting filler in their nose, because it can be a higher risk area, right? So what are some of the things that people should look out for?
If you're thinking about non-surgical rhinoplasty, you have to go to somebody who's very experienced injector, and a very experienced injector specifically with non-surgical rhinoplasty. In general, filler injections in the face are very, very safe procedures, but there's always some risk to anything that you do. So of all the areas of the face, the nose is the highest risk. And so when you go to somebody for non-surgical rhinoplasty, you want to make sure that this is a person who's experienced with injectables, experienced with non-surgical rhinoplasty, who understands how to prevent complications, who understands how to manage complications. And that kind of information is not so easy to come by, but I think experience is the key, right? And so but not price. Of all the procedures that you do, this is the one that you don't want to choose someone based on price. You can have a complication where it doesn't look quite like how you want it to look, where maybe the top is a little bit thick, or it's just not quite right. And that's kind of an easy complication to manage, because that's the nice thing about hyaluronic acid fillers, is you can dissolve them. But there's other complications that are more serious. So you can have issues with blood flow to the tissues, ischemia, necrosis, and extremely, extremely rarely, there have been cases of blindness reported And when those cases of blindness are reported, they're reported in this area, so glabella and nose. I think that a lot of those cases are cases that have happened in Asia and have happened with practitioners who shouldn't be injecting, like in nail salons or hair salons and things like that. But it's there. That risk, very, very, very small, but it exists. And so you want to minimize it as much as possible. I take a ton of precautions to make sure that it never happens. It's never happened in my practice. Over 20 years, do it daily, every day, several times a day, because I take a lot of precautions. And so I think that's important to keep in mind.
And that happens from filler going into a vein or an artery?
We think it happens because filler gets into an artery and goes backwards into the ophthalmic circulation. Those, we're not quite positive as to the exact mechanism of why blindness happens. This is our kind of thinking of how it happens. It may be that it has something to do with vascular malformation that this person in particular has that make them more susceptible to something like this happening. We're not sure. And we're investigating it, with I'm investigating with my colleagues quite a bit. We talk about it and try to figure this out. All over the world, there's a lot of attention being paid to, why does this happen? What is the mechanism? What can we do about it? So, but that's what we're thinking.
So I would love to talk really briefly about some of your favorite underrated procedures. It sounds like this might be one of them, just because I would imagine when people go to get filler or get an aesthetic treatment done, it's not the first thing that they're necessarily thinking, unless they're coming to you. Maybe for some people, but I would imagine overwhelmingly people are thinking lips, cheeks, things like that. What are some other underrated procedures or areas of the face that you like to treat?
I love the nose. So whenever somebody talks about, hey, what's your favorite procedure? What do you think about this procedure? What do you think is the coolest procedure? I'm just going to say the nose, because it's just, I love the kind of, I have people in my office cry tears of joy after non-surgical rhinoplasty every week. It's the coolest thing. It just changes people's lives. It's wonderful. But overall, I think also what's really underrated is the temples. Because people don't look at their temples that much and don't kind of, at this point, not yet. I think that, unfortunately, the filler companies are very much invested in, making people self-conscious about certain parts of their face. So that may change and people may be looking at their temples a lot more. But because now there's an indication. So now as soon as there's an FDA approved indication, there's all sorts of advertising about it. And now suddenly people are going to be like, oh my God, temples. But I think the temples are really important in the impression of age of someone's face. When there's hollowing in the temples, I think it's a giveaway. And so a lot of my conversations in the clinic are, I just feel like I'm looking older and I'm having this kind of stuff going on and there's heaviness here and there's just kind of, and we talk about that kind of thing. And then I find that I'm oftentimes talking about their temples and they're surprised that I'm mentioning that area. And I'm like, you just got to trust me. If we do this, you're going to see a big result. And then I do one side and I show them the mirror to see, so that they can see the contrast. And they're bowled over by how intense that change really is. So I think the temples are really quite important. The other area that I think is not frequently mentioned is the forehead. To my mind, for a female identifying person, attractiveness equals femininity, fertility, and youth, right? And so those three components together. An important aspect of femininity is a forehead that's convex. Just a little bit of convexity, a little softness in the forehead. Because when we're younger, we have that convexity in the forehead. As we get older, it gets flattened or else gets even concave. And that is a masculinizing kind of feature. When you correct that, again, the effect is really impressive in terms of how the overall impression of being of femininity. So I like that quite a bit.
How do you correct that?
Same filler.
Oh, filler?
Yeah. So you can go.
But you said glabella.
But that's down here. That's over
okay,
here. So I'm talking about up here, still an area that has its risks. So it's an area that you need to be careful with, but it can be done. Usually I use a cannula. So I'm going down on top of the bone. And so I'm going underneath the vasculature. So there's ways of doing things safely, because there's a lot of, then there's all this kind of, there's chatter about like, well, you shouldn't do the forehead because it's a risky area to inject. I mean, there's ways of making sure that you're doing this in a safe manner. So, and the results are really worthwhile.
What about the flip side of that? What are some overrated procedures?
I think that sometimes in our rush to identify procedures that are alternatives to filler, we attach a little bit more weight to certain things that are maybe a little bit more questionable. And I think threads are a good example of that. I know practitioners that I respect quite a bit that like threads and that do threads. I certainly don't mean to say that you should never do threads, because I think there's a place for threads. I just think that sometimes there's kind of an overestimation of the efficacy of threads. And, I want to see some more long-term results of threads that show that this effect really persists over time. Because I think there's a little bit of wishful, and this is the thing about our industry. There's some wishful thinking going on, right? There's a role for threads, but I'd like to see it become more defined, because I think people are kind of throwing threads in just kind of willy-nilly sometimes. And I think threads are particularly not a great idea for the nose, because there's not a lot of, I've dealt with complications of that. There's not a lot of precision to threads in the nose, and I don't think it's a great idea. The other thing that I think is kind of, again, so you say, what are things that are like not great? I think some of these wishful thinking concepts are what we're talking about. So there's people that talk about, well, if you put filler into here, all the way behind here, that like pulls it.
He's pointing at around his hairline.
Oh yeah, sorry. Yeah. So behind the hairline, if you put a bunch of filler behind the hairline, if you put a bunch of filler behind your ear, like that somehow pulls things. And that there's this concept of like, oh, well, if you put filler into like your cheekbone, that like somehow magically lifts up your jowls. That's just not the case. And I think you had another person talking about that here, and it's absolutely true. So I think if we can just kind of stick to evidence-based suggestions, that's nice. But there's some wishful thinking stuff that happens. Yeah.
I think that there was definitely a trend. I mean, I'm not in the industry, but just from being on the outside and seeing a lot of people and living in LA, I think there was a trend for a while of trying to lift with filler. I don't know if people are still doing it as much, or if enough people have, had the experience of realizing, oh, this doesn't work. But
yeah, I think it
seems like there's a trend back towards more natural now.
I agree. I think that there was a trend of injectors being afraid of filling the nasolabial folds, first of all. And then saying, okay, well, I'm scared of filling the nasolabial folds because there's a vessel that's down there. There's a facial artery that's there. I don't want to get into it and have a problem. And so I'm going to just fill the cheek. And then the cheek, I know, will lift up the nasolabial fold. And we know that does happen a little bit, but it doesn't happen a lot. It's just like there's a small effect. But they're like, well, if there's a small effect, well, if I put more in there, there's going to be a bigger effect. So I won't have to fill the nasolabial fold at all. I'll just lift everything, over here. And then you have, a bunch of people, their patients walking around looking kind of weird because they're way over full in their cheeks and their cheekbones. Or there was the thought that like, well, if I just put enough into the cheeks and the cheekbones, that will lift a jowl. And we're talking about maleficent territory there in order to really lift a jowl. And nobody wants that. Fillers don't lift. They fill, they will volumize. And when they do that, there is some change in the regional area where you're putting it into, where the skin or the position of the skin may change subtly. But it's not something that lifts. And I think that people have, again, with wishful thinking, they'll pull up on the skin and then put a bunch of filler, they'll pull up on the skin, put some filler in there and be like, okay, that really lifts. Well, filler is not a thumbtack, right? I mean, it's not going to it's not anchored into your bone. And so it's not going to lift. Doesn't happen. It's just like a little bit of little jelly under your skin.
Is there anything coming down the pipeline that you can tell us about? Any new products, any new procedures that we can be looking forward to?
I'll tell you one thing that I'm hoping is coming down, but I don't have anything concrete to tell you that it actually is. Devices and procedures to actually tighten the skin. It's been a lot of years and a lot of hope and not a lot of results. We've seen devices and procedures that can improve the quality of the skin. We've seen some of them that can maybe do fairly subtle tightening, but we haven't seen anything that's really impressive. So I'll tell you, hopefully, and I know everybody knows that there's a ton of money to, there's a pot of gold waiting for the person that invents something that really works. And so I know people are working on it. I'm personally excited about different categories of fillers that are being investigated these days by a variety of companies. AbbVie is working on a bunch of very interesting fillers. I know that there's a few other companies that are working on interesting stuff. They work in a little bit different ways than the fillers that we're used to now. And they're also biostimulating different components, like a lot more so we stimulate collagen, but then there's products that perhaps stimulate elastin and other components of the skin that I think will be really interesting to see. So I'm excited about that stuff.
Me too.
So, yeah.
Well, thank you so much for coming on. Tell everybody where they can find you.
So on Instagram, it's dr.rifkin, dr.rifkin. And then on TikTok, it's the same thing. Hopefully TikTok will, continue to be someplace that people go. I don't know.
Oh yeah. Everyone loves TikTok.
Yeah.
Thank you so much.
Thank you. I really appreciate being here.
Thank you.